Chapter 9, Leaky Gut. What is leaky gut? Zonulin, a protein, opens up the spaces between the cells of the intestinal lining. That normally occurs in order for nutrients and other molecules to get in and out of the intestine. However, when intestinal permeability, also known as leaky gut, is present, the spaces between the cells open up too much, allowing larger protein molecules to get into the bloodstream, where an immunologic reaction can take place. Once that happens, the body is primed to react to those proteins each and every time they appear. Some causes of leaky gut are dysbiosis, stress, genetic predisposition, and diet. This image depicts what's occurring with leaky gut. So as you can see at the top in black and white, we have our brush border, our mucus layer, and we have tight junctions. What happens is the zonulin opens up those junctions and allows protein molecules to go through. And you can see in the bottom that it also has the plasma membrane and how these are entering the bloodstream. So they think that this is the cause of many of the autoimmune disorders that we are seeing in patients today. The two most powerful triggers to open the zonulin door are gluten, gliadin, a glycoprotein found in wheat, and harmful gut bacteria, dysbiosis, in the small intestine. As the zonulin level rises, the seal between the intestinal cells diminishes, opening up spaces between cells that allow all sorts of things to pass right through, and this is called leaky gut. Leaky gut management requires a few things, according to the functional medicine model of healing the gut. Each of these 5 steps will be discussed in a moment. Step 1, remove the offending substance. 2, replace. 3, repopulate. 4, repair. And 5, rebalance. Remove refers to the elimination of factors such as pathogenic microflora, for example bacteria or fungi, foods to which an individual is sensitive, intolerant, or allergic, environmental stressors such as pollutants, and stress. Replace refers to the replacement of factors that may be inadequate or lacking. Clinical approaches could be enzyme therapy, fiber to support gastrointestinal function, herbal or antibiotic support to kill off undesirable bacteria. It is imperative that this is followed up with repopulating with desirable bacteria. Repopulate or reinoculate. This refers to the reintroduction of desirable gastrointestinal microflora through prebiotics or probiotics, such as fiber or FOS, inulin, probiotic-rich foods, such as fermented foods, also supplementing with probiotics as instructed by a care practitioner. Repair. Provide nutritional support for healing and regeneration of the gastrointestinal mucosa. Some common nutrients that help repair the gastrointestinal tract are glutamine, arginine, vitamins D, A, C, and zinc. Gut-associated lymphatic tissue support through lactoferrin or lactoperioxidase, antioxidants, and micronutrients such as pantothenic acid, vitamin E, and carotenoids. Rebalance. This refers to providing support for restorative processes, things such as mindful eating, yoga, prayer, meditation, time management, and relaxation techniques, when done in a holistic manner, can go a long way for helping restore leaky gut. Leaky gut is responsible, they believe, for many of the autoimmune diseases that we are seeing in patients today. Leaky gut proteins are mistaken for viable tissue, and that genetics have a lot to do with whether or not your body will then turn on itself, as we see in many of the autoimmune diseases in patients today. Clearing up leaky gut goes a long way to restoring health for many patients with autoimmune disorders.